Hello, Curriculum Committee. Hope you're having a great summer. Who doesn't want to do more course approvals? All right, I do have something for you real quick that has come about this summer due to some unusual circumstances. So I'd like to bring two course proposals forward to you for your review and hopefully for your approval. Uh, Jennifer will be sending this link out to you, and the attached course proposals should only take a couple minutes of your time to review those. If you have any questions, please feel free to email me directly. But I think it will be relatively simple and hopefully a quick vote to approve to get these items all set for the academic year. So let me show you exactly what we're talking about with these two course proposals and why are they coming to you now at the very absolute last minute. Well, as you know, we have a phlebotomy program here at Mercy College. Over the past year, I've been moving that phlebotomy program to other support divisions within the college for them to assume those roles that were traditionally assumed within the short-term education area, such as payments, business office, admissions, and also the registrar, which we were all functioning in those duties over here, and they really don't belong here. So part of this was moving the record keeping of phlebotomy coursework to Mark, to the college registrar, and also to have that within Empower. Now, as we were finding out just this week, in order to put it into Empower, we need to have an actual course, a course title, a course number. That was pretty easy to determine what those would be. That only took a little while. Again, these courses, this content has been running for years within our phlebotomy program, so that nothing new is being brought forward here. What is triggering the change is the fact that we need to enter this into an Empower with an actual course title, an alpha, and a numeric. And Dr. Bates thought it would be great if we could bring this actually through curriculum. Now, here's also what's new. This is a non-credit course. I repeat, non-credit. Curriculum has never looked at non-credit activities. In the future, you will be looking at any non-credit activities, any coursework will be brought through curriculum. So this is also kind of a nice transition, if you will, into that, and really a very needed one, having a second pair of eyes on these courses, on maybe other future programs, within the academic setting here at the college. So here we go. We've got two courses that I'd like to show you. Again, these have been run for many years within the phlebotomy program. This content has been there, but we're kind of rebranding it in order to put it into Empower. The first one I bring forward is Phlebotomy Theory and Practice. And remember, this is non-credit, so you got to let go of the credit world here because some of these things will not apply. But with Phlebotomy Theory and Practice is the name of the first course. And this will be a pass-fail course, has an unusual prefix. Don't let that throw you. It's going to be CEDPH. Again, Mark has already set all of this up. And this will be CEDPH01, the first course in the series of a two-course series. And I got a little proposal and rationale. Again, I've already mentioned that to you. It's really triggered. This meeting I'm coming to you is because of Empower. That we have to put this into Empower. The phlebotomy program is made up of two courses. One is this classroom, which is basically classroom and laboratory together. And then after they complete this, they go out to their practicum and actually practice phlebotomy, practice venipuncture, drawing blood. The course description: this course covers essential professional knowledge required of an entry-level phlebotomist: anatomy, physiology, infection control, patient safety, HIPAA, professionalism, medical terminology, and venipuncture techniques will be studied. Students will also practice laboratory skills and venipuncture techniques necessary for clinical fieldwork. Again, this is no credit hours assigned. It does run over a 5-week period, and students meet about twice. Well, they do meet twice a week. So that gives you a little bit of an idea what's required there. Okay, so that's this first class. Do have the, you can look over the course learning objectives. But again, it's really the theoretical and laboratory practice that they need before heading out to clinical. They complete this course in its entirety before moving on to this one. So they do the first 5 weeks in class, in lab, practicing, learning, quizzes, tests, theoretical knowledge, practicing on rubber arms, and then they're done, and then they go out to clinic if they successfully pass the first course, which most of them do. That we've had very few problems of folks passing that first course, but it has happened, or they've needed a little extra time before going out to clinic. All right, this next one is the clinical course. I'm calling it phlebotomy practicum, nothing exciting there. And that's going to be a CED PH02. Again, this is the second course in the whole phlebotomy program of two courses. And this course, with the catalog description that I'm recommending, is this course gives students the opportunity to gain hands-on experience and document the required clinical competencies for the NCPT, National Certified Phlebotomy Technician, certification examination. Students will be required to perform 100 successful venipunctures during a 100-hour clinical practice under the supervision of qualified instructors and preceptors. So again, students are out there for 100 hours and they have to do what we call 100 sticks. Again, no credit hours assigned to this, but there is an actual physical number of hours that they do have to be out there. And we have some pretty basic course learning objectives for this clinical experience. So, what you're looking at there are these two courses. Again, they make up the entire phlebotomy program, and we need to load those into Empower very soon because we'll be starting our fall students, in August. They start at the beginning of the semester as well. So, we were looking for an approval for these items. If you could please signify through email vote, and hopefully we can reach quorum this summer and get that officially on the books. I did talk to Jennifer just a few moments ago. She will then have this recorded in the meeting minutes when you convene in August. It'll be formally in the minutes that we approved this item over the summer. All right, any questions, let me know. Thank you so much for watching this video, and hopefully you'll approve these items. Thanks.